my presentation. I know you guys are used to product. Is this thing still working? Okay, it is. I'm trying to rush, guys. This time killer is going to kill me. um, I want to start off my presentation because I've worked in Haleon for just a year. So I'm kind of new. I can still flex that. But this year has been eventful for me. So I'm going to show you a slither of some of the activities you guys have done because I think it's worth appreciating and I hope the sound is going to work. Regardless. Uh, okay. So you have to imagine the best soundtrack of your life. I wanted to show you guys some of the work that we've done with you over the past year. This is from an outreach perspective. And you guys send in requests. I know sometimes when you're in the picture of something, it's very difficult to see the frame. That's why I had put together this amateur video just to kind of show some of the work you did in various places that you did it and to eventually also show the impact that it had. Um, we personally, I do really love the work that you do, coming from a very, very different industry and knowing how the health systems in Kenya are set up. I don't know if you guys realize the importance of the work that you do because health literacy is very low, oral health is significantly marginalized, and the outreach allows for people who would never have access to your specialty, your profession, your even your technique in actually executing your work, it gives people access to that. So for that, I thank you. To be able to reach over 2 million people on radio, over 3 million on television, and just over 70,000 actually getting treated from the work that you do in the camps is very impactful. And I wanted to start off by saying thank you. Now, that leads me to another piece of work that we do as Haleon. There is a health inclusivity index, and I'll encourage you guys as I'm speaking to just scan that QR code, save that link, and have a look at it, in your separate time, preferably on a big screen. It's a very interactive report. So it's a very comprehensive report that is done by The Economist and supported by Haleon, where we actually look at the impact of health inclusivity. What is health inclusivity as a base? It is the process by which we remove any cultural, personal, social, or political barriers to people having access to good quality health, physical health, and mental health. So the study takes a three-phase approach. It started in 2022, where they first started by doing an audit of the existing policies that we have in our markets. Kenya is one of the countries included in this study. They looked at it over 6 WHO regions. Kenya is amongst the 40 markets that were being studied. And the first phase was looking at our policies, infrastructure in place, you know. Then the second phase looks at the lived experience where they actually now go and speak to people. In Kenya we say we took our ground in a different. So you might have the policy in place, but how does it actually present in real life? Then the third phase, which is what we are currently in 2025, is actually looking at the economic impact of what our health inclusivity status looks like. Now, I'll focus in on the third phase because that's where we are at 2025. And you guys are an association, so this is more for you to see how you can advocate for the things that we need from an oral health perspective when it comes to our public structures. The phase looks at the impact of one, improving health literacy. What would that do to our country? Reducing contributors of or outcomes contributors to and outcomes of health inequality amongst lower income groups. That's going to be important. And in that space, we looked at tooth decay, gum disease. Again, we are all in the Kenya space, operating in the Kenya space here. The amount of data available on oral health, could be more. So it's always nice to have a focus around it and add to the pool of existing information. And then reducing the burden of health challenges in women, and finally, improving inclusivity in people aged above 50. Now, this information is important. Data, I always say, is very important in not just your, for the nation, for us to know, oh, this is how things are. You guys are, most of you are entrepreneurs because you have your own clinical practices. And some of you are also taking the time to better yourselves. You're, going for your masters, going for more, uh, further education. So you need to know what is the need in the market and how am I going to fill it. And information like this helps you strategize in a long-term lens for what you need. Now, in Kenya, for example, just a snapshot, our health literacy, if it was to be increased by 25%, that would look like 196 million USD kind of saved, right? This is because you're getting less people spending, like you're reducing the amounts that people have to spend within a clinical space because you've provided for them, you've made health inclusive, and then it covers them better. Now, why this is important for you guys, I notice trends around a lot more Kenyans are into the aesthetic features when it comes to their oral health. They want to get their teeth straightened, so the orthodontists are having a field day. They're getting whitening procedures done, etc. If you are able to release yourselves of smaller procedures that include just the basic thing of how do you clean your teeth, is there a product in the market to clean your teeth enough? Then you are able to concentrate more on things that add value even within your practice and inform what you go to study further. So that's just one area. Of course, because we looked at oral health, I just took the snapshots of what they found within tooth decay. And again, the savings are significant, both from tooth decay perspective and gum disease. So that's how we read markets in totality. But we take it further and ask Kenyans themselves. So we actually sit with Kantar, a research company, and find Kenyans to come and give us responses. Why do they brush their teeth? So first, most important thing is an effective clean is what they want. So we have a nature and a general hygiene of cleanliness in this country. You'll find even in places where they don't have tools, I've learned they're using cloths, they're using the sticks. It's not okay, but you can tell hygiene is important. Next, preventing caries and decay, and keeping their breath fresh. That leads into like more cosmetic or vanity KPIs, which also speaks to they need to see their teeth looking whiter. And finally, protecting their enamel. So these are the most important things that matter to most Kenyans when it comes to why they even bother with cleaning their teeth. So we've introduced something, a Sensodyne cavity and sensitivity new product, and you're going to have a taste of it later on. Um, so with this product, we are hoping to address, those things that we've noted that the general population needs, but also make it accessible from a pricing perspective. It. Oh, that's standard. Oh, okay. Let me use this. So yes, as I was saying, it provides both cavity and sensitivity protection. The key features, the mint flavors around it, the triple cleaning action, the foaminess of it. Um, it has fluoride, like optimized fluoride technology to help remineralization of teeth. And then, of course, potassium nitrate when it comes to the sensitivity element. But I'll go straight into the mode of action video, which, because there's no sound, is also going to give me hell. Guys, do you know Murphy's Law? Everything that can go wrong will go wrong. And that is today. Anyway, so I'll just try and like, as it plays on, basically this is just demonstrating what your tooth surface looks like, um, and how now sensitivity and cavity will be working. The dual action of it, um, from a cavity protection side, and then of course with sensitivity relief. Da, da, da. So this is how it allows for like more uptake of fluoride on the enamel surface. Da. Anyway, when the reps come around to you, they'll probably have something that, will have the audio on and hopefully not be doing this to you. And then, of course, the sensitivity protection, you know how potassium nitrate is a depolarizing agent and goes into your dentinal tubules and then calms your nerves. Of course, twice a day brushing helps with making sure the concentration is maintained so that they are consistently getting that protection relief. So when you come to our booth, we'll make sure that that's one of the products you get to take away so that you can have a try of it yourself. Because it's a more daily use product, yourselves, you can use it, because I think that also has come as a key concern for many people. They're always like, what is good enough for the full family? This is one that we want to bring to you guys. And of course, you as dentists can also use it all the time. Now, there's no way I would speak about cavity and sensitivity and not go into dentin hypersensitivity, which is our forte, and I'm being looked at funny. So you guys know that dentin hypersensitivity, the prevalence is high, but it's not spoken about. And 1 in 2 of your patients could actually be suffering from it, but they're just not reporting. It impacts the quality of their lives from a functional, social, and emotional perspective. So it's important for you guys to have a routine way of actually checking on it. And why patients don't speak about it is because they have a lot of dental anxiety. That's what we've observed with many people. This stems from fearing pain or things of that nature and wanting the process to, move out faster. So we call it nocebo effect. They have this heightened fear that it will be worse than what it actually is. And then from the dentist side, what we note is that there's this perceived lack of importance for the condition. Sometimes also you're trying to churn out patients as fast as possible in your institution. So you're not taking the time to actually do a proper questioning of the patients when they come to you. So the condition itself is also hard to diagnose because it's very subjective. You rely on the patient's self-reporting, or there's just a lack of uniformity in it. So what the Middle East and Africa region did, we put together a few dentists, and they came up with an algorithm to help with prescribing dentin hypersensitivity. And it takes 3 steps: ask, screen test, and treat. In the first bit, it just informs you guys simply asking all your patients indiscriminately if they experience dentin hypersensitivity or any forms of that kind of pain. That's very important. Some of them will tell you yes, some of them will tell you no. If they do tell you yes, you then screen them with a dentin hypersensitivity questionnaire, because that lets you know what's the severity of the sensitivity and also gives you more insights on how it's impacting the quality of their lives. But if they say no, you can do a cold blast air test, and we'll do that at the at the exhibition booth. So I'm trying to rush. You can do a cold air blast test just so that you can actually test if they actually have it. This is for patients who say no, that they don't have sensitivity. There's also other methods of checking. There's visual analog scales that are used, numeric pain scales, and the shift scale that will kind of inform you how bad or how severe is this patient's sensitivity. Once that's been established, it's also important to check for differential diagnosis, because sensitivity is not the thing they always present primarily with. So they might come in with another issue, and it's important to check that all their other issues are kind of covered. Finally, you move into treat, which takes a multi-step approach. And based on the severity, which is why it's important to do the screening and the testing, it will let you know, does this person just need at-home treatments where you actually teach them how to brush properly, what kind of brushes are they using, soft bristle, not hurting their gums, the pressure, etc.? Or do they need more support where they actually need to come into the clinical space for you to do something based on the severity of their sensitivity? So yeah, that's it. It starts by looking at the behavioral management, home-based treatments, and then finally in-office treatments. I think I'm about done. So thank you for your time. I know that it's been full of hiccups, but yeah, thank you for your time. And
all right,
the other things.
Thank you very much. And they have their booth out there. Please make sure you visit them and see what they have. I will quickly want let's give a round of applause.